elderly lady came in the other day complaining of low back pain. In fact, the pain had started down into the back of her right leg. Hi, I'm Dr. Emmanuel Morenings. Today I want to talk to you about low back pain and even sciatica. Sciatica would be the pain that goes down the back of your leg. It can stop at the buttock, the butt cheek, can halfway even go to the knee, or it can even go all the way down to the foot. Very, very painful and certainly concerning to this patient as she came in. Even more concerning to her was the fact that she was taking care of her young grandchildren for her daughter as her daughter worked. And she loved her grandkids and wanted to take care of them, but with the pain that she had and the problems, she just wasn't able to do that. We examined her. We took a history, found that she had some injuries in the past and that hadn't been taken care of. And as she started lifting on these little kids, it had aggravated a problem that existed actually for quite some time. We took films and found that she had degenerative changes in her lower back that also affected that. Well, the good news is we were able to help this lady, and in fact, saw her just the other day, and she is enjoying being able to take care of her grandbabies. And also she loves gardening and working outside. And the neat thing is not just to get rid of the pain, but to allow people to function again. And as we read the news reports today of the opiate crisis, and by the way, this crisis has been going on for decades. It wasn't just something they discovered a few months or a year or two ago. This has been going on, and finally now has seen the light of day. And I'm thankful that there's action that's being taken. The problem is that opiates and painkillers and even anti-inflammatories don't solve what the problem is with back pain. When we have a misalignment of the spine, or what is called a subluxation in the chiropractic world, when that misalignment happens, it causes nerve impingement. Impingement is pinching or rubbing on the nerves. And when those nerves get rubbed on and pinched, then they're going to cause inflammation and, of course, then swelling and pain. And that pain can be localized, or it can be also the radiating pain, such as with sciatica. Chiropractic is the only healing art that deals so effectively with sciatica, with back issues. What we do is find what the cause of the problem is. And as we can find the cause of the problem, and if it is a misalignment in subluxation, as it is in so many cases, if it can be corrected and then stabilized, then the problem goes away. The neat thing is when our bodies give us pain, that's a signal that there's something wrong. Once we can find the problem and correct it, the body then literally shuts down that pain process without the need of drugs, without the need of surgery. So the takeaway with this is, this lady got her life back. She loves to garden. She loves to do things on her little farm that she has. And even as she hits her 70s, she's active and able to do things that, well, she hadn't been able to do in some time. So if you have back problems, whether it's with sciatica or just localized back pain, the first thing to do, even before you reach for your over-the-counter anti-inflammatories or pain relievers, get a chiropractic evaluation, find out what the cause of the problem is, and get that taken care of. I hope this is helpful to you, and if it is, share it with your friends and family. Certainly invite them to come in for a consultation. I'm happy to do that with any patient. There's no cost or obligation for that. Happy to do that as a service to our community. Have a great day. Have a blessed day.